At the end of last month, a nasty case of cold and flu started rapidly making its way through urban centers, including Kampala. This wave has left at least 4 in 5 people coughing and sneezing.
I got flu and body weaknesses and chills and this were the best. I treated it early because my friends were sick. So I didn't want to wait.
Health centers have also seen a spike in the number of people coming in to seek medical treatment.
There is a rise of people coming to the hospital to check. But again, when you do a correlation, like you compare those who are coughing and those who are coming to us, these are the ones who can afford.
Some even sought to self-medicate instead of seeking professional advice, while others are relying on natural remedies.
I took drugs, prescribed drugs, but actually they didn't work that well. I went off drugs and I used concoctions and they proved to be good.
Walaji, no tangawuzi, nanasi, ne kale fruits.
No kubera nti bwoba oliddemu embeera n'ogezaako ku nniimu n'okwejjanjaba entangawuzi bwe bityo.
Dr. Augustine Daga, a senior doctor based at Wandika Medical Chambers, attributes this sharp rise in flu and cough infections to the weather changes.
There is, I don't know whether you see what I'm doing, like a linear relationship between humidity and viruses. And so when we're talking about flu and cough, January is a hot season. So you can expect that you can have a linear correlation with flu and cough.
All this comes at a time when many are concerned about rising infections of COVID-19, particularly from the Omicron variant.
But again, we are cognizant of the fact that we also have COVID-19 around. And specifically we have the variant, which is Omicron, which is difficult to distinguish from the ordinary flu or the ordinary wave of flu that we are used to, except in a few circumstances.
Since the COVID-19 Omicron variant has similar symptoms to the normal cough and flu, Dr. Ndaga is urging patients to test in order to correctly diagnose and treat one's ailment.
The hospital, what are we going to do? Of course, we're going to do the normal clinical proceedings. We take history, we examine, and then we do the lab tests. The ultimate worst way of doing it would be that you take a swab, we check. Do you have COVID? You don't have COVID.
However, Dr. Ndaga strongly discourages patients from engaging in steaming as a way of treating either diseases.
Whether you've gathered a basin of herbals, put them in a saucepan, and you inhale those hot air bubbles into the lungs. What happens when they reach in the lungs? They condense and become fluids or liquids. So that means you've exported fluids to the lungs, which are supposed to be filled with air. Are you going to breathe normally?
But most importantly, Dr. Ndaga urges patients to comply with the COVID-19 SOPs in order to avoid contracting either the Omicron variant or flu and cough.
Wear your mask. It doesn't hurt to wash the hands, really. It doesn't hurt. Wash their hands. It's not that they are going to degenerate like soap. Wash them as many times as you can.
On Wednesday this week, the Health Ministry revealed that it's conducting an investigation into this wave of flu and cough to ensure that the country is not experiencing an influenza outbreak. The ministry is expected to make a preliminary report on this investigation as soon as possible. Joyce Nakatong, NTV Weekend Edition.